I'm Joseph Connors. I've spent my 30 years here in BC primarily looking after patients, but I've also had the privilege of coordinating some of the activities of an expanding research group that's focused on learning more about the biology of these same diseases. The challenge with looking after as complex a problem as cancer is taking the best advantage of new technologies and new techniques that become available to understand the basic biology. Because we're not going to make fundamental progress against cancers without understanding how the malignant cells differ from normal cells, what keeps them alive, what drives them and governs their behavior. So the exciting thing about innovation and changes in technology is that the tools we have to do this today are remarkably better than just 5 or 10 years ago. And it's the application of those tools that's so exciting. The primary inspiration is in the clinic. I go and I meet with patients who are dealing with diseases that threaten their lives, and many times I'm unfortunately unable to save them from their disease. That's a strong motivator. I don't want to ever have to do that again if I can avoid it. And so from there, I go to the scientists and I say, this is what was happening. This is what I saw going on clinically. This is what failed to work. I need you to use these fancy, special new techniques to tell me what was going on at the biological level so that I can work with you and other researchers to identify interventions. I worked with a wonderful doctor, Dr. Saul Rosenberg at Stanford University, who had devoted his life to understanding Hodgkin lymphoma. And that showed me how a clinically oriented physician can work with a collection of scientists to help to make progress. When I came to British Columbia, clinicians here, like Dr. Paul Climo, led the way in terms of building a group that would focus on their clinical management. And then working with colleagues like Dr. Gascoigne and Dr. Merritt allowed me to continue to have this kind of interaction with very exciting people, people that are generating new ideas, bringing new techniques to bear, and with them actually seeing stepwise progress made in the understanding of these illnesses. The future I see is so rich and promising because of the additional understanding that we're now being able to bring to the problem. In the past, the treatment of cancer has been largely empirically derived, but we didn't fundamentally understand what it was we were manipulating, what we were trying to change. Today, the whole paradigm is changing. Now we're identifying genetic errors, miscommunications and false communications that go on within cells and between the malignant cells and their environment. And we can now start to isolate the aspects of these cells and their interactions that are unique to the cancer cells. That in turn suggests ways to step in and manipulate those differences. I think we'll be able to develop increasingly effective treatments for smaller and smaller groups of people.